Dr. Piercy, I'd like to ask you about what Tennessee has been doing to prepare for school reopenings. If you could speak in maybe a little more detail, as I think that could be really helpful to those that are starting to think through those issues for themselves. Elementary, middle, and high schools, all different, and I'm wondering what kind of guidance has the state offered to your communities, and who have you brought to the table to come up with the plan that you have?
Sure, those are great questions and questions that we're thinking about every day. As you mentioned very astutely, there are different needs based on different ages of children. And even going down to early childhood, it's pretty unlikely that a preschooler is going to keep a facial covering on. So what can we do in order to mitigate the spread in those early childhood classrooms? Compare that to older children, middle schoolers and high schoolers, who would tolerate that better and could be more compliant. But it's not only about that behavior in our children, but it's about setting up the physical environment. So in Tennessee, the Department of Education, the Department of Health has tried to offer both broad conceptual guidance as well as concrete practical tips. Even things that are incredibly useful and easy to do, like making 90-second videos for teachers to say, if your classroom looks like this is how you should set it up. Or this is how you get kids to go in the same direction in narrow spaces. And so very practical tips that our teachers can use. The other thing that we have done and we feel is really important is making sure that our schools are adequately equipped. And it takes a lot of hand sanitizer. It takes a lot of soap and water. It takes a lot of personal protective equipment for school nurses. We're leveraging our EMA agency in order to be able to provide for those needs for schools so they can safely reopen. And more than anything, providing actual education on the disease, but also on how to rapidly identify and mitigate any cases that will inevitably pop up. And that also takes into consideration setting appropriate expectations for parents and for teachers and for staff. Because with the enhanced vigilance of all of the different factors of parents, when they think that their child is at risk, they may take extreme measures. And so if they hear of a first case in the school, what we don't want to do is them to immediately take their child out of school, because that's not what is best for that child and the holistic needs of that child. So setting expectations for parents and educating them on, we have a plan for what happens, and we have a stepwise approach that we want to take in order to maximize the learning potential for those kids.
Great, thanks very much. Dr. Goza, I wanted to ask you about what you think pediatricians can do to help with this process of speaking with parents, with families, with schools, administrators. How can pediatricians help with this?
So I will tell you, our guidance came out based on the fact that we had many pediatricians calling us saying we need to know what to tell parents about school. And we need to know how to talk to them about this, and we need to be able to work with our counties and our school systems, because we want to be at the table as they decide how we're going to do this and how we're going to do it safely, so that children and teachers and staff are all protected as they go back to school. And just about the realistic expectations of the, we may start back in school and we may have to change gears as we get into school if the prevalence increases in your community. So we have a campaign out, Call Your Pediatrician, and I tell people, if your parents have questions about whether they should go to school and what they should do about their children with special needs, or they have questions about this, call your pediatrician, because they're willing to talk to you about this. We're there to help parents make the best decisions for their families as to what's in the best interest of their children and families.
Great, thanks very much. I want to ask both you, Dr. Goza, and Dr. Piercy. One concern is that we know a lot of parents are very anxious, so much so that some don't take their children to pediatricians for healthcare visits because they fear that there may be something at your office that could cause their children harm, that their children could become infected, that they could become infected. So how do we reach parents to let them know the facts about the importance of addressing health needs, with school being an important part of a child's health needs?
I think the key word that you just mentioned was facts. Because, like all of us, there are lots of different sources of information coming at us all day, every day. And we have to be able to parse through what is reliable and trusted information. And so giving parents those facts about not only the safety in getting back to a pediatrician's office, but the consequences of what can happen if one doesn't. It's been mentioned multiple times here already today, but I am deeply concerned about the decrease in immunization rates and the decrease in the amount of all patients, children and adults alike, presenting for typical health conditions. And so what we might find ourselves in is a situation where it would be even worse than just COVID alone. And so I believe that all starts with education. The AAP is an incredibly trusted partner in providing that, as is the CDC. And so that would be my key take-home message to parents, is find your news from a reputable source.
So at the AAP, like I said, we started our Call Your Pediatrician campaign. I hope y'all all saw the little panda who got his checkup. And we said, if the panda can get his checkup, your children need their checkups too. It's a very cute little video. But anyway, so we've been really working on this. I've been doing a lot of interviews telling parents, call your pediatrician, because we don't want children to have misdiagnoses. We want children to get their vaccines. And we are a safer source of information. But the American Academy of Pediatrics also has a parent website called healthychildren.org that has lots of information there about COVID-19. It has our school guidelines, school reopening guidelines on there. And so there's information there for parents as well. So I would encourage everybody, if they know anybody, say healthychildren.org is a great source of correct information for parents to access as well.
Great, thanks very much for that information. Dr. Redfield, can you comment on what we know about the epidemiology of this virus in terms of its effects on children and adolescents?
Well, I think first, I think it's important to realize that we do know this virus obviously infects all age groups. It's not clear to us yet, and as I mentioned, our household studies, the role that children play in the transmission cycle. For example, in our household studies so far, there was limited implications that the virus was brought into the household by a child. This would be different, say, than influenza, where it really drives the epidemic frequently, the children transmission in schools. But what we do know is that this virus also has probably one of the widest ranges of disease penetration, from totally asymptomatic, to mild symptoms, to symptoms to the point you go to the hospital, you have some pulmonary insufficiency, all the way to ICU and death. So it's quite a spectrum of disease. And it does, I think when we looked at individuals under the age of 45, they represent 2.4% of all the deaths in this country. And when you look at them, those individuals under 45 frequently had a significant comorbidity, significant obesity, diabetes type 1. So this virus does seem to be very limited pathogenicity for children. Now there is an exception. There's a post-inflammatory syndrome that is very rare. There's several hundred cases that have been reported where it appears that the immune response to the virus causes a post-inflammatory syndrome and can be quite significant. And maybe our colleague wants to comment about it. But I think that's important, that really the individuals under the age of clearly 45 that don't have a significant comorbidity, that this virus has very limited pathogenicity. I would be remiss, since I may not get another question, just to ask the one thing that I do think it's important for me to be the advocate for all of you, is that this is the year to really promote influenza vaccination. And I think people know that I'm quite concerned about the fall and winter when we have these two respiratory pathogens emerging. And it can be very complicated, obviously, in the school setting if we all of a sudden have an epidemic of a respiratory illness. The only difference is flu is likely to be symptomatic in the children, all right? And of course, the COVID is likely to be asymptomatic. But this is the real year to try to really embrace vaccination with confidence, particularly for flu vaccine.
Dr. Goza, do you want to comment any further?
No, I think Dr. Redfield covered the post-inflammatory syndrome very well. It's still very rare, lots of more information to be learned about it as we go forward, but there are people looking at it very closely at the academy and trying to figure out what we need to do.
Okay, great. And no worries, Dr. Redfield, I do have more questions for you. Dr. Piercy, Tennessee has many rural communities, and we know there are a lot of challenges to virtual learning. They may not have broadband access, but there are also transportation challenges for children going back to school. How's Tennessee addressing the issue of transportation in the reopening process?
Yes, ma'am, you bring up a good point that we have a very wide geography in Tennessee with a lot of diversity. We have rural counties that, believe it or not, are still in the single digits of case counts. We have metro areas that are exceeding 12,000. And so in Tennessee, we've learned that one size doesn't fit all. There are specific needs in our rural communities, like transportation, like technology. And so that's why it's been important for us to be able to work on the local level to individualize the response. Transportation is one of those things that a lot of our rural children rely upon. And so we have to be able to do that in a safe manner. Things like skipping seats or cohorting kids in seats that are in the same household. And we are also working with very practical tips for bus drivers. It's not practical for a bus driver to screen kids as they come onto the bus. And so whether that's an at-home attestation prior to getting on the bus, or whether that's screened immediately after departing the bus, those types of practical tips are ways that we're addressing transportation, for example. And that's something that our districts are looking for. They're looking for that very specific blocking and tackling day-to-day guidance that they need to be able to offer a safe environment for their children. And so in Tennessee, we've created toolkits, and toolkits from transportation to how do you do meals, how do you do choir and band, things that have been mentioned before. And then something that's very popular everywhere, but particularly in the South, how are we going to do football in the fall? And so these are the kind of things that we're looking at and working with our stakeholders every day.
Great, thanks very much. I have a couple of questions that I want to just pose to everybody and give everybody a chance to answer. The first was, I'm wondering if you all go out and you travel a lot, you talk to a lot of people. I'm wondering if you can describe an issue or a concern that someone brought to you in the process of considering school reopening that surprised you or concerned you because maybe it wasn't factually based. And I'm just wondering how you dealt with that. Dr. Piercy?
I can go first.
Okay.
You know, something that we have seen, and we've put it sort of on our best practices list, is there is a very rare instance when an entire district has to be closed. And I know that was the approach at the beginning, and it's been referenced earlier, these wide sweeping restrictions. But as we're going back to school, we really need to talk about an individualized and very specific approach. It may be that in the inevitable case that these infections come into schools, that you close a classroom, or you close a wing or a corridor, and perhaps the entire building. But that's something that we heard that it's an all or none on a district opening or closing, which is really not based in science and is certainly not the best way to educate all of the children across an entire district.
That's a great point. Thanks very much.
So I'll have to disagree. I haven't been traveling much since March. I've been in my office and in my home, and I have a little corner of my office that is now called my studio for when I get interview requests. But so I think one of the biggest questions I get from parents is, But what if they come home and we want to go visit the grandparents, and they've been exposed then, and how do we keep our grandparents and our family that may have health issues safe? And so I think that's a big question that's on the minds of a lot of parents, and just reassuring them that the schools will be safe, and that we will have that information, that if we do see COVID in the schools, that the parents will know about it, because I think they sometimes think that the schools keep it secret, so they don't want to let them know that they've been exposed. I don't think that ever happens, but that's kind of their thought process. And so reassuring parents that the school systems, the public health, and the pediatricians will all be working together to keep their children safe is very important.
Yeah, I have two maybe quick things. One is, I think one of the biggest challenges we're having right now is how to really communicate the message of the importance of social distancing, mask and hand hygiene to the millennials and Generation X individuals. I don't think we've been very successful in that. And, we've talked about it. I know when I call my children on the phone, I never get a response, but when I text them, they get back to me within about 5 minutes or less. I do think we need a strategy. I don't think we've hit home there. I don't think the younger group understands how important it is for them to fully participate in the social distancing. The other is that we talked about, that this isn't all or none. There's a lot of space in between, and I think we have to be more open to embracing those gray zones. And I think the one as a physician that's probably saddened me the most, and I've been involved in this, is individuals that are in end of life, and they've really been denied any access to their family members. There clearly is a safe way that those family members could have had access. When I see people dying talking to their parents on the phone, it really kind of bothers me. So I do think those are the two things that I think we as physicians and healthcare professionals, it's not black or white. There is a gray there, and we can find a safe way for that gray to take place.
Thanks very much. Those are very important points. I want to ask each of you to just comment about what we should be doing in an ongoing fashion. So we've talked a lot about the process of reopening schools and the importance of that, but what should we be doing to continually reassure parents, families, those that work in our schools, that the school is safe, even if there's a rise in cases in the community?
I think one of the lessons that we've learned, not only as it pertains to schools, but in the entire response, is to avoid extremes. And when everything is one way or the other, that doesn't lend itself to learning and to applying new learning about what we're finding out about this disease process. And what happens when one takes one extreme or the other is that when you get new information, you suddenly perpetuate mistrust. And we want parents to trust us, and we want parents to be able to rest safely or rest assured in that their children are going to be taken care of safely. And so I think transparency is a really important part of that. Transparency even about the uncertainty. I'm not sure anybody's got this completely figured out yet. And no school district has this completely figured out yet. And I guarantee there will be something that happens that's unexpected. And so communicating that transparency to parents and setting that realistic expectations of this is our plan right now, but we're in constant communication with our health officials, with our local leaders. We're looking at the data on a regular, almost daily basis and making those decisions sometimes on the fly. That's okay, because we want to be able to customize that approach to what's best for that school at that time. And so really communicating transparently and ensuring that everybody remains flexible in the process is really important.
I think that goes back to our saying that we have to be able to switch gears very quickly and be very nimble and flexible. We are learning about this disease. If we went back to what we said early in March, it's totally different than what we know now. or not totally different, but a lot different. And we've started doing guidelines instead of policies at the academy related to COVID-19 because we do know that we need to review them very frequently because they are updated very often with the new data that we have. And so, in letting parents know that we are watching that data, we are watching what's going on, we are going to be able to change as the information that we receive changes and the data changes.
Yeah, I think it's important. When I made my opening comments, I made the point is that we need to plan to open these schools with the understanding that COVID-19 is going to occur. I really think it's important to get ahead of the curve for schools and parents and teachers to kind of understand ahead of time how that school is going to respond when in fact they do get a case or a cluster of cases, you know, as opposed to necessarily getting the storyboards going and overreacting and really starting going down a path. As you know, I mentioned that CDC did not recommend the schools be closed. But obviously the civil leaders made that decision. I'm not critical of it. I'm just saying from a public health point of view, we didn't see that schools needed to be closed generally. There may have been in certain schools that we saw should be closed because of outbreaks, just like we do for influenza. When it occurs, we shut down sporadically a school here and there to try to close the epidemic, or measles. But I do think getting ahead of the curve that you're talking about, how you're going to handle cases of COVID in the school when you diagnose them, so that doesn't become some type of 9 o'clock at night phone call tree that goes through the community, and the next thing you know, you have the school shut down for a week, rather than everyone being on board how we're going to handle this. I think that's really important.
Thanks very much. We have time for one last question, and that question is, for each of you, what would be the one key take-home message that you want people who hear this to get today?
So in addition to being a state health official, my more important role is I'm a mother of 4. I have one that's about to start college and then 3 in high school. And what I want to know is that my children are going to be safe. And I also want to know that I can trust those making the decisions, that they're going to take all of this into consideration when they're making these incredibly impactful decisions. It was mentioned earlier, but even those of us who have resources and have good coping skills, our children have struggled through this. And they don't, fortunately, have to worry about some of the other very serious social issues that some students do. So recognizing that this impacts all students, taking this approach to getting our kids safely back into school is probably one of the single most important things we can do to reopen our state, reopen our economy, and get on with our lives.
So just like our guidance says, we do believe that the goal should be for every state to have the goal of in-person school, but with those schools opening safely.
And I would just echo the most important thing from my point of view, from a public health point of view, from a risk versus risk point of view, that we need to reopen our schools. And we need to plan to keep our schools reopened. I think this really is the important message, and this is why we're having these discussions, to get people to understand that we need to reopen the schools. We can do this safely. We need to commit to it, and we need just to get it done.
Well, I'd like to thank all of our panelists for a really interesting and important discussion, and I hope that this will help our communities to think through the reopening of their schools and what that's going to entail. Thanks very much.